Welcome to the Kidney Trails Virtual Summit. I am your delighted host, Anthony Reed. I'm one of the moderators here. And also, we've had a wonderful time with the Kidney Trail Summit. I can tell you that. Had a lot of good information, and we're really excited about this next presentation, next session we're doing. It's talking about taking patient education to the next level. And I think by doing that, it's going to definitely enhance and help so many different people. So, without further ado, I would like to introduce to you our speaker, Dr. Rehan Shah. Dr. Shah,
All
please
right.
take it away.
Hi, everyone. My name's, as Anthony mentioned, Dr. Rehan Shah. I'm a nephrologist. I trained at SUNY Downstate in Brooklyn, New York, where I did my residency and my fellowship. And then from there was in Georgia. And then currently I reside in Dallas, Texas. So thank you so much for having me. And I know, thank you so much for Kidney Trails. This was an amazing platform. And just to get everyone together, I know it was a huge task, but you guys did it, and it's really phenomenal. And really excited to be a part of this. So, with that, I would like to introduce my company, our Creative Health Media. It's really, something from my own personal experience as a nephrologist, as a clinician, is it's always been very challenging to educate our patients, and it just requires a lot of resources. And unfortunately, when we talk about like our home penetration rate or transplant or just knowledge about kidney disease for our patients, because the current landscape is just fragmented, it's and the resources required kind of brought to inception our company, Creative Health Media. So with that, I'm going to do a short presentation and then be able to show you a demo of our platform as well. So let me go through this here. Can everyone see my screen? I'm assuming so. Okay. All right. So, so I'm not going to go over the impact. I think we've, in even previous discussions, we've learned how much of a burden kidney disease is on our society. But this is towards the challenges that we've had, right? So, as a clinician, I will tell you that the content that we're delivering, and you also have witnessed, is currently very fragmented. It doesn't take a patient through the full journey of kidney disease, from what is kidney disease all the way to home treatments, transplantation, and then how to cope with kidney disease. So knowing that it's very fragmented is very difficult to understand kind of that progression. The other aspect to this was that it's always been content from the patient, from the provider perspective. So from clinicians or so, saying that this is what you need to know, and this is how you deliver that. So because it's only from that perspective, it's hard to relate to the content being delivered. So that's been a significant issue. So to make sure that we're combining the perspective of the patient as well as the physicians and the providers, and coming together and creating this. So, and lastly, just overall, is that there's no kind of data. Like, so we know we're delivering data, in education, but are our patients learning from that? And to be able to provide objective feedback as well as data on improving or not improving on the education that's been delivered. So those have been overall the challenges that we've had in delivering kidney disease education. So what we did in our mission at Creative Health Media was to tackle all those challenges, put it together, and leverage technology to be able to deliver this education. And that's how Creative Health Media came about. And I'll show you this in the demo, but basically our technology goes through the whole workflow of a practice, right? It's like, how do you start when a patient first comes in, delivering the education, being able to track the education that's being delivered, being able to see how they're doing, and then at the end, also being able to bill for it, because KDE is a reimbursable program, which only currently 5% of practices are actually billing for KDE because it does require a lot of resources to be able to deliver that. The topics that we talk about in our program is what is kidney disease, nutrition, managing complications such as hypertension, diabetes, dialysis options, transplant, and then living with kidney disease. So really taking patients through the full journey of education. And I think we've experienced some education that's out there right now, but what we've done is and what differentiates us as a company is putting this all together and tackling this on a multifaceted approach. So in terms of the education content, I mentioned that it's not just our perspective as a provider, but it's also the patient perspective. And to then take those videos, to take this content and make it engaging, right? Like to have someone being lectured or patient being lectured for 20, 30 minutes, they're not going to retain it. We're not going to hold their attention. But if we can have engaging videos and create animation as we did here, that's where we can, increase engagement for our patients. The second was the technology part that I mentioned, and I'll show you this in our live demo. We also have an SMS feature that allows us to reinforce the knowledge that we're delivering. And then third part is to work with the practices to be, true partners with them and deliver, this tool to them and give them the control and the autonomy to be able to deliver this education. So really empowering the practice, the physician practices with this software to be able to deliver and help improve the practice's overall outcomes as well. At the end, you need the right team to be successful, and this is, I think the core of our business is bringing everyone together. Our CEO, her name is Navina Reddy. She's been a dietitian for many years. Our COO is Gary Holderby. He's been in the tech industry as well for over 20 plus years. And in addition to that, we have our contributors who've been very actively engaged with us. And we have Dr. Patrick Dunn, who works with the American Heart Association and is a PhD in motivation learning theory. So going through our content, making sure that the delivery of the content drives behavioral change. We have Dr. Rafai. He's a great educator. We have Dr. Rampal, who's a transplant nephrologist, to ensure that we're addressing that. And then our patient contributors, Dawn, John, and Scott, are very involved in the industry, and I'm sure some of you guys know them as well. But that was bringing the patient perspective onto our program. We have a pre-test and a post-test to assess patients' knowledge, whoever is going through that, and then a series of text messages. And I'll show you this in real time. In terms of the data, I'm going to show you this as well. But the great thing here is that we're able to provide feedback to the practice on how their patients are doing. So, for example, we're not only saying in terms of success areas, percentage of patients improved and 58 improved in their average score. So we're able to show that the patients are improving overall in the practice. But I could also tell you focus areas. So for example, these are the questions here, like the third question, what is GFR? And we could provide feedback to the practice that, look, most of the patients are not understanding what GFR is. Can you please, explain that in further detail to your patients? And that feedback is extremely crucial, so we can, number one, identify where they may have issues in terms of their knowledge, but then provide feedback to the practice so they can implement on that as well. Just some initial data here. We're working with some of the larger practices out there as well. This is feedback from them. We've been able to show that between their pre-test and their post-test scores, that we've been able to increase their knowledge by 58%. So they've improved in their score from after pre and after watching the videos. They've scored a 95. In fact, actually, the most recent score here percentage here is about 62%. So we're showing that, after watching our content and our education, that our patients are more educated on that. And the feedback that we're getting on the surveys at the end, after the 6 videos, we have a survey, and this is some of those survey results. So 100% of patients rated the program as good or excellent. 57% of patients said they were more confident in taking better care of their health. 100% of patients rated the materials easy to understand, important to me. 71% of patients said they would consider getting dialysis access placement when recommended, and 100% of patients said they would recommend the program. And this is just some of the text messages that go back and forth between that. And I'll just kind of briefly mention this is the ROI model. So as I mentioned, CMS reimburses for kidney disease education, and they can bill for this. So we're giving the practice the tools, the documentation, and the education required to submit reimbursement for that. And really, by them getting into this, it's giving them further revenue to invest into the practice and to further educate the patients and add services that perhaps were not resources were not allocated to before. And lastly, and this is validation for us as a company and why we do what we do, but it's just amazing to just get this feedback. So the video was excellent. Can you send me the next one? You really heard me. Thank you for caring so much. I got 100% on my post test. I felt good about having more knowledge about my disease. Thank you so much. I'm gaining quite a bit of knowledge. I wish I had suggested this connection with Creative Health Media sooner. Great info. So that's been really the reason and what validates everything that we do as a company. So I'm gonna go into a more live demo mode here to show you our platform. Is there any questions, anything I could address right now, or should I move on to the demo?
No questions at this time.
Okay, so yeah, let me go into our demo. This is our website. And from our website, we have 2 portals, one for the patient and one for the physician practices. So the physician practice will go into sign in. Everyone has a username, password. By logging in, sorry, one second here. Oh, sorry, that page expired. I'm going there again. Okay, sorry about that. Okay, here we go. Okay, sorry about that. So yeah, so this is when you log in. This is the main screen that you see. It's the dashboard. But what we've made it is it's so that it's very easy for the providers and the office staff to be able to look at all their data, their patients, see how everyone's doing, and get a good snapshot of that. So we have here are the physicians. These are how many patients are enrolled in the program. We have our total sessions yet to start, in progress, and how many are completed. These are our locations. So practice with multiple locations can track it per facility. And then our test analysis. So how many are completed, perfect score, improved, no change, or decreased. And then these are our survey results as well. So, and these are just kind of sample, more test pilot results here, but very easy to read, and being able to get a very quick snapshot on their assessment of their education. So then we have locations. We can separate out each location for the facility. This is total number of patients that we have. And then the other thing is we could generate all types of reports. I could create a PDF file for that practice and just provide a tremendous amount of data to the practice. So I wanted to show you how to add a patient, and knowing how busy practices are, we wanted to create this to be very user friendly for not just the patient, but also for the provider and for the practice. Well, that it should not tie them down or slow them down at all. So we go to patients, we just add add a patient. I'll just put my initials here for now. We just put put the number in, and then we choose who the physician is, and then I say send text. And when you send a text, I know you can't see this now, but it's an automated text that goes out. I know, Anthony, you've seen it. I actually don't have my phone connected here, but actually, hold on, maybe I could just I don't know if you guys can see this, but yeah, but basically an automatic text goes out. Sorry, I know that was pretty rudimentary, but yeah, there's a text that goes out, says, "Welcome to Creative Health Media. Dr. Shah would like to assign you the educational program." And then from there, you'll see that my name shows up here. And then what I do here is I just select a video. These are the 6 videos in the post test. I could choose different sequences. I don't have to go one by one or down this. Like, for example, if it's a patient who needs to just learn about transplant right away, I could just pick transplant there. So basically, I go to assign, and now that is assigned to me. So so what does this look like on the patient standpoint? So the great thing is that you can access this at any on the patient's phone. You can access this on the computer. And you can watch it an unlimited amount of time. So what I'm going to do is with every assignment, the patient has a 6-digit code. So this will show up on the phone or so. But I was able to pull that code up on my end, and the text message that the patient gets this code as well. So really went through like every kind of stepwise approach, and this is what the patients see on their portal. So when they go on their phone or on the web, they'll get very simple a screen that gives some instructions, but everything happens. It's very automated. So I could choose right here. I would click this. The first thing that shows up is, what do kidneys do? So these are the pretest, and it'll take you through the pretest, and then after this, we'll see the video. Okay, so success, you have completed the pretest. And then from there, it automatically gets into the video. And I'm just going to show us a short clip of this.
Hello, welcome to Kidney Disease Education Series. In the next few weeks, you will be educated on how to care for your kidneys so that you could prolong its function for as long as possible. The series includes 6 short videos talking about kidney disease and treatment options. There are virus and bacterial waste or
so we have all the
CR.
So we're talking about GFR. We're talking about the stages of kidney disease.
Taking medication.
And we have different patients. We have different physicians that we have, and our goal was to keep obviously the demographics, ethnicities, so that patients can and everyone can relate to the videos and to the characters. So once you're done with the video, then you go to click here to attend post test, and then you have the questions come up. And in this one, like you'll see that it'll tell you the right or wrong answer. So green was the right answer, is all of the above, and the red was wrong. And you'll click next. So that was correct. And then it'll take you to the next question. And then that was the right answer. That was wrong. So now, once you finish that, you'll see the pre-test score was 67, post-test 33. And then from there, you just return back to the dashboard. And here's the status here. It says completed. And now I could watch, as a patient, I could watch as many times as I like. This is full access 24/7. You can watch the videos with your family members as many times you need. We know one-time education is never enough. So everyone has, at their fingertips, full access to this, and it's just that 6-digit code that gives anyone access, or that patient access. We also follow that with a handout, and basically it's just a summary of the video. So each one has a summary page that takes and highlights the main points that were there. So, after you're watching the video, you just want to have resources handy. You could quickly go through all the resources needed for that. So then going back to that, 1 second. So now we have that. So here, if the patient needs to log out, they could just log out and you're back at this screen again. So that's how that's our platform. And I know that was pretty fast, but wanted to show you, really incorporating the technology piece of creating this platform that takes patients through the full journey, but also to empower practices to be able to utilize this. And we have an account manager on our end, and pretty much takes over all the kind of the duties required to kind of spearhead this, and for the practice, simplify that whole process so they're not inundated with trying to educate. So far we're seeing great results, and we're really excited and looking to really grow this and work with practices on a national level, as well as organizations and as well as payers, and to take it out there and show that this really would benefit, and we have the results to prove it as well. Yeah, so that's it.
Excellent. We appreciate that, Dr. Shaw. And I think it's phenomenal to bring in technology and to actually incorporate it into patient education. I think it's so very important, especially with the way the world's changing. It seems like with creative health media, that's exactly what you are doing.
Yeah.
And I think it could definitely help other individuals, somebody such as myself, when I was diagnosed with kidney disease, had I had something like this, or even if I'd have known from either, any of my medical care team could have had me sit and watch these films, and it helped me been more educated about what was going on, so I think that's a wonderful what y'all are doing. We're going to check the chat. While we're checking the chat, if anybody in the Zoom room has a question, if they want to raise their hand or put it in the comments, we'll be happy to get that question to Dr. Shaw, and we will definitely get you on there. Diane, how are we doing over there?
Alex just said tuning in from Ohio.
Okay, we have Alexandra Rosa. She's tuning in from Ohio. Great session.
No chats right now.
Well, one of the things is when you're talking about this, as far as taking this, one of the questions that I would have for what y'all were doing is, not everybody uses technology. Is there any specific ways that y'all have seen to be able to get around this? Maybe, that not everybody may not have a smartphone. It seems like the majority does, but I'm sure there's a select few that may not have a smartphone or smart device. What other ways could somebody actually get access to this?
Yeah, so great question. It's actually amazing because we were surprised to see that more people than not actually had access to technology than we kind of anticipated. And it wasn't just a smartphone; it's having a computer at home. It's and that's why this is not just kind of an app setup. It's more a secure website that we have established. And so you can log on your home computer, laptop, we had actually had a patient who goes to the local library and access it there as well. So definitely wanted to make it, accessible and not just limited to kind of smartphones, number one. But the second part to this is that we also provide tablets to our physician practices. So for example, patient walks in, we have a tablet assigned to Creative Health Media. So the patients can watch those 15 minutes of videos prior to seeing their regular clinic visit. So that tablet is provided into the waiting room, headphones, or in a conference room, but they're watching it while they're there for their appointment. So that's a way we've addressed the kind of the technology piece, is that if we could provide that technology to the practice, well, if the patient's in that situation, they're doing it right there and it's kind of fresh in their mind, and then they're addressing any questions with that provider, with their physician, right there and then.
Excellent. And then another question, I don't know, you may have said it, I may have missed it, but how many total videos do y'all have with this program?
Six videos. So each of those topics was what CMS has put out in terms of the kidney disease education reimbursable billing, and those are the six videos that we've created. Each one is about 10-15 minutes.
Okay.
Yeah.
Okay, I think that's wonderful. I mean, 10 to 15 minutes of educating yourself to do something, to learn more about what you're facing for as kidney disease.
Yeah.
I think that's just fantastic to be able to have that. And far as getting this, I know it's pretty. How long has this Creative Health Media been going on?
It's been about 2 years. I definitely creating that platform was a significant part to it, and the content. So I would say at least 2 years, and then bringing it to market, probably I would say maybe 6 to 7 months or so.
Okay, that's wonderful. And I think our audience, we're looking at the chat, we're not seeing anything yet, but like I said, anybody in the Zoom room, if you have a question, you're more than welcome to raise your hand or unmute yourself, and we'll bring you up to the stage so you can ask Dr. Shah a question regarding what him and Creative Health Media is doing to help enhance patient engagement. And I think, like I said before, taking the technology and kind of combined it seems like some different aspects of the medical field, it's a little bit behind times. Yeah. So it's really good to see, bringing dialysis, or not just dialysis, bringing the kidney disease arena realm up to the times. I think that can be a huge impact. So I don't see any other comments. Is there any last words you would like to leave us with, Dr. Shah?
Yeah, no, thank you so much, Anthony and Kidney Trails for having me. Definitely, if you could share, my contact. Sorry, I actually had that up. But yeah, if there's any questions for us, this is our team. That's my cell. That's my email. But yeah, feel free to call us, and love to get your input, because anything we can do better, we always strive to do that. And we're excited about really taking this platform to the next level, and would love for us to kind of put our minds together and collaborate into how we can further help our community with education.
Okay, excellent. We appreciate that.
Yeah.
So to our live streaming world out there, where we're all on our social media channels, we'd like to thank you for tuning in. We appreciate you tuning in to the Kidney Trail Summit. We still have one event to go, so you got a few minutes to take a break before we start that. Here in about 30 minutes, we'll start the next event. But we do thank you for being here and for definitely supporting us in this endeavor. Y'all have a great day.